Fenestration and dehiscence. So what is fenestration and dehiscence? So fenestration is also called as windows. Fenestration is windows. So fenestration is a circumscribed hole in the cortical plate over the root and does not communicate with the crustal margin. So fenestration is a circumscribed hole in the cortical plate over the root and does not communicate with the crustal margin. So here the crustal margin is intact, but hole in the cortical plate over the root. This is called fenestration. So in this situation, marginal bone is intact. It is seen in cases where the root is curved and the alveolar process coronally may be intact and the bone may be absent, making a window like defect corresponding to the prominent root. So it is a window like defect over the prominent root surface, but here the marginal bone is intact. These are the important points about fenestration. What is dehiscence? Dehiscence is also called as cleft. So when the denuded roots are exposed through the marginal bone, the defect is called dehiscence. So the root are exposed through the marginal bone. There is no covering the bone on the root. This is called dehiscence. In this area where the tooth is labially placed. So the labial alveolar process may be very thinner or even absent, forming a dehiscence. So mostly it is occur on the labial surface. So the labial alveolar process may be very thinner or may be absent. It is called dehiscence. What are the predisposing factors of fenestration and dehiscence? One is malpositions of tooth and prominent root contour and labial protrusion of the root combined with thin bony plates. So malposition tooth, prominent root contours and labial protrusion of the root. These are the predisposing factors for fenestration and dehiscence. What are the clinical features? They occur approximately at the age of 20 years. So they are more common on the facial surface than on the lingual, and it is more commonly on the anterior than the posterior teeth. So it is most commonly on the facial surface than the lingual surface, and it is most commonly occur in the anterior teeth than the posterior teeth, and they are frequently bilateral in distribution. So these are the important points: bilateral distribution and anterior than posterior. And what are the significance of fenestration and dehiscence? They may predispose gingival recession and increases the rate of progression of recession, and they may complicate outcome of periodontal surgery. These are the significance. So it may predispose gingival recession and increase the rate of progression of recession, and they may complicate outcome of the periodontal surgery. So here this picture showing there is a fenestration and dehiscence. So in fenestration, there is a marginal bone is intact. There is present of marginal bone. In dehiscence, there is no marginal bone. Directly the denuded root are seen. There is no bone covering the root.